Hello and welcome to Patient Power. I'm Andrew Shore. Now, you may not know the name Dave DeBronkart, but you might know the name ePatient Dave. It's the same guy from Nashua, New Hampshire, north of Boston, diagnosed with kidney cancer in 2007. And he sought information from others on the internet. He got smart, and it saved his life. And he really has become one of the leading evangelists for ePatients, powerful patients. So we caught up with him at the European Society of Medical Oncology meeting in Madrid, and he explained to us the transformation that's gone on as we've become ePatients.
It's a fundamental change that's driven by the availability of the internet, which in a way has created a sort of capillary flow by which information can flow to places that weren't available before. So if you think of information as a nutrient, it's easy to see how the existence of the internet makes it possible for two things to happen that were not possible in the past. One is just for information to reach people who 20, 30 years ago could not get at it. Information that's in the literature that used to be only in academic medical centers. But the other thing that's turning out to be transformational is that patients can talk to each other. I mean, I never knew anybody in my life who had stage 4 kidney cancer, but the moment I got connected with a patient network, I knew an incredible range of things, not just facts about treatment options, but also how to deal with side effects and the emotional experience. You know, the question that was burning on my mind when I was diagnosed was, how likely am I to die from this? Like, is my life ending now? I could not, anywhere, National Cancer Institute, Kidney Cancer Association, anywhere, get a straight answer to that. It just isn't something that people get grants to produce information on. But in the patient community, within 2 hours of my posting my first message there, I got an incredible range of perspectives. You know, and one, to me, in hindsight, it's fun, but a fun example of that is people said, you know, welcome to the club that nobody wants to join. And on the subject of, am I dying? They said, if you don't want to die of kidney cancer, then your goal is one thing: live long enough to die of something else first. Now, you'd never see that in the literature, but you know, if you feel trapped, completely cornered with no escape, the idea that you just need to live long enough to get hit by a truck, you know, or something like that, it's liberating. You know, and that gets into the question now of, for whose benefit are we doing care? For whose benefit are we doing health care? For whose benefit do we do treatments? For whose benefit do we do research using the scientific method? You know, if it's for the patient's benefit, which I think everybody would agree, then doesn't it make sense to ask them, even though they may not understand the cellular biology, the DNA process, genomics and everything, ask them what outcomes they would like to have pursued. You know, I know people who know that sooner or later this disease is going to get them, but they would like to have their life go better, you know, for however many years that's going to be. And my purpose here, I know I have a very close relationship with the oncologists and surgeons who helped save my life. They went through an awful lot of training to get to where they are, to get the licensing and accumulate the years of clinical experience. I want them to have a good life, a rewarding life, you know? And if we can work together to create a new dynamic where care is more likely to produce a feeling of being cared for, right? One of my slogans in some of my speeches is, if the microscope is happy, but the patient is not, have we achieved care? So and in a way, it's an unfair burden to expect researchers to figure out what would benefit the patient, right? When perhaps in a good discussion, we can let patients participate.
We have more from our interview with ePatient Dave coming up, so be sure to be signed up for alerts on our website so you'll know whenever we post something new. I'm Andrew Shore. Remember, Knowledge can be the best medicine of all.